Hi, good day everyone. So what we are going to do today is administration of oral medication. First, we are going to gather our equipments. Our equipments would be our medication trolley, our cups to administer the medication in, spoons, hand sanitizer, a bottle of water which should be sealed at all times, and a medication tray to actually take to the patient to administer the meds. You will wear your appropriate PPEs if needed, and your administration notes, which will be your doctor's notes and your nurse's notes. So first we will gather our equipments, which we did. Check each medication order against the original in the medical notes according to the hospital policy. We will check each medication order against the original in the medical notes according to your hospital policy. Clarify any misconceptions. Check the patient's chart for allergies. So what we do according to the hospital policy, we will use our prescription sheet and checking it with our nurse's notes. If you do not have a prescription sheet, you can use your doctor's notes to clarify your medication. You must always know the actions, special nursing considerations, safe dose range, purpose of administration, and adverse effects of your medication to be administered. Consider the appropriateness of the medication for this patient. We would then go and perform hand hygiene.
I have my hand sanitizer right here, so I'm performing hand hygiene. I had previously washed my hands.
We are allowed to use hand sanitizer for
Up to 3 times.
up to 3 times. Then we would move to our sink and wash our hands with soap and water. We would then move the medication trolley in front of the patient's bed or chair, making sure you are facing the patient at all times. Your back is not to be faced to the patient. You would always prepare one medication for one patient at a time. Before administration, we would then confirm our 10 rights. Our 10 rights consist of the right patient, the right medication, the right dose, the right assessment, the right evaluation, right documentation. So during the course of administering medication, those 10 rights will be followed. We would then identify the patient.
Good morning again, sir.
Morning.
I am Nurse Sant. Can you tell me your name, please?
James Smith.
Okay, Mr. Smith, I just want to have a look at your name tag as well to verify that I have the correct notes with the correct patient. Okay? All right, Mr. Smith. All right.
Usually the patient should be identified using 2 methods. One method can be check the name and identification number on the patient identification band, which was done. Ask the patient to state his or her name and date of birth based on the hospital policy. You can also, if the patient cannot identify him or herself due to medical problems such as dementia or Alzheimer's, you will verify the patient identification with a staff member who knows the patient for the second source.
The patient is conscious, alert, and oriented and was able to state his name, and I also verified with the name band.
You would then complete the necessary assessment before administering medication. Check the patient allergy bracelet or ask the patient about allergies.
All right, so sir, I see here from your notes that you don't have any allergies. Is that accurate?
It says
All right, so there's nothing that you're allergic to in medication or food.
no.
Explain the purpose and action of each medication to the patient.
All right, so I have some medications for you, and when I take out the medication and I bring it, I will explain what each of the medication is. Is that all right?
That's fine.
If your patient is in bed, you will make sure that your patient is sitting upright. For example, this patient is sitting on the chair, so he is currently upright.
So sir, earlier on we did your vital signs, and I can see here from my notes that it is within acceptable limits. All right? which means that you're able to get your medication, and you decided to have a sit-out today.
Yeah.
You're comfortable where you are?
Yeah, I'm fine.
Okay.
You would then go back to your trolley and you will do your 3 checks to administer your medication.
So I'm taking out your medication and I'll be back with you soon, right?
Okay.
So my first check will be when I take the medication out of the trolley, I'm going to compare it with the notes that I had already verified. So enalapril 5 milligrams, PO, expiry date 2021. That is my first check. Right? I am now going to put the enalapril here. So I'm going to verify again. Enalapril 5 milligrams, PO, expiry 2021. The second month, 2021. Right? 1 tablet. And my third check before I return the medication to the trolley, enalapril 5 milligrams, PO, expiry date the second month, 2021, and I return the medication. Alright, the next medication I have is aspirin. Again, first check, I take the aspirin out and I compare it with my notes. Aspirin 81 milligram, PO once a day. Aspirin 81 milligram, PO once a day, expiry date the second month 2020. That is the 2021. That is the first check. I'm going to come here now. My second check before I pour it in. Aspirin 81 milligram, PO, expiry date the second month 2021. Right, I'll pour it in. Alright, before I return, I'm going to have a repeat check. Aspirin 81 milligram, PO, expiry date the second month 2021. That is my 3 checks of the 2 medication. Pause.
Explain the purpose and action of each medication to the patient before administering.
Okay, so this is your sealed bottle of water you can use. Alright? This medication here is the aspirin. Right? The aspirin is given to prevent your clots forming in your blood. Alright? So it thins the blood. Right? You've had aspirin before?
Yes.
Alright. Have you had any at all this morning?
No.
Alright. Okay, so it helps thin the blood. It does have some side effects, which is sometimes you can have some bleeding, some excess bleeding. So I need you to watch when you're brushing your teeth if there's any bleeding in the gums, if you're seeing any obvious bruising on your skin, or if you're passing any blood in the urine, you have to inform us. Alright? Is that okay?
That's fine.
Right. So, would you like some hand sanitizer?
No problem.
When was the last time you had your hand hygiene?
5 minutes ago.
Right. So let's just be on the safe side and do the hand sanitizer, right? Alright, so that's that one. Okay? Right, the next one is enalapril. Enalapril is for high blood pressure. While your blood pressure is not high at present, it is to maintain adequate blood pressure for it not to become elevated. Right? However, it does have some side effects, and one of the side effects is that if you move too suddenly from a lying to a sitting or to a standing position, you could have some dizziness and some weakness. So I would urge you to be careful when you're moving. Right? Is that okay?
That's fine.
Alright. So, and you need to let us know, myself or any of the other members of staff, if you should experience any of those side effects that I've informed you about.
Okay.
Okay? So you're ready to take your medication?
Yep.
Okay? I will be returning within half an hour after the medication has been given to recheck your vital signs and to see if you have any of the signs and the side effects that we discussed earlier on. Alright?
Okay.
You would remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside.
Alright, so I am going to stay with the patient. Of course, I'm not going to have to swallow the medication, but I am going to stay. And one of the ways that we can be sure that he does take the medication is I can have a conversation with him afterwards and observe that it is not anywhere in his mouth. Right?
Assist the patient to a comfortable position.
Are you comfortable as you are, sir? Would you like
Very
to go
much.
back to bed?
I'm fine.
Performing hand hygiene on yourself. You would document.
So, sir, as I said, please let us, inform us at any time if you should have any of the effects we talked about, the side effects we talked about.
No problem.
Okay, I'm just going to go write up your notes.
You would document the administration of the medication immediately after administering to your patient.
Right, so,
Because the patient had hypertensive drug, the nurse would obviously come back and recheck his vital signs in about 30 minutes or so. So we have 10 rights of administering medication: the right patient, the right medication, the right dose, the right time, the right route, the right education, the right to refuse, the right assessment, the right evaluation, and the right documentation. During the course of this video, I hope you can have a look and notice your 10 rights that was completed. That is the end of administering of oral medication. Thank you.